This here is called a stethoscope. It is the classical and universal symbol for doctors. It goes around your neck like so, and people use it to auscultate the heart by putting these in the ear like that, and you put this to your chest in different locations. And this is probably the only thing you need when you're going to medical school, but I've got a few other things that I want to share with you guys. I've got this little case which the stethoscope goes into. Let's talk about this thing here. This thing is called a otoscope. I mainly use it as a source of light, but you can use it as an otoscope if you want. It's got this little groove here on which you can attach little speculums, and you can look into people's nostrils, into people's ears and other things. But most of the time, proper otoscopes and proper ophthalmoscopes are available at the patient's bedside, so this usually is not needed. I mainly just carry it around just in case, but it's a very good flashlight if you need it. Next, let's talk about tendon hammers. So tendon hammers, you use it. Oh wait, no, that's not a tendon hammer. That's a cricket mallet. Don't use this as a tendon hammer. My bad. Let's talk about tendon hammers right there. So tendon hammers come in different flavors. You've got this little mallet-like thing here. You've got this triangle-looking thing here, and you've got this big round thing here, which sort of detaches, and you can turn it into a more pedunculated kind of tendon hammer, which most people are used to. This is the best one of the three in terms of eliciting reflexes, because you get the biggest overall moment, to transfer the maximum amount of force at the smallest point in order to really elicit reflexes the best you can. So I've got all three of these. These two I've elicited a lot of reflexes with, but this one never fails. So this is the one that I would recommend. It also comes with a handy dandy little Babinski needle at the bottom, so you can test Babinski reflex on the toes if you want to with it. Next are these things. They're called tuning forks. You hear that? You can probably hear that. Yep. That's a 256 hertz, and that's a 512 hertz tuning fork. These are used to test different things, often neurological things such as hearing, and another thing called vibration sense on your joints and on your digits. That way we can find out if you've got any problems with the dorsal column of your spinal cord, or if you've got any sensorineural or any kind of hearing loss, be it conductive or sensory. Next, we need a couple of screwdrivers to really screw in the few little loose nuts inside anti-vaxxers' heads. But yeah, usually they don't use screwdrivers like this. You usually need sterile screwdrivers for that, because we want to avoid sepsis. Next, we need the other thing that I have is this thing. It's called a pulse oximeter. You just press the power button on it like that. It turns on, and you put it on your finger. And after a few seconds, it's going to read your pulse, and it's going to read your blood oxygen saturations. Your blood oxygen saturations pretty much mean how much of your hemoglobin, how much of the hemoglobin which is being detected by this is actually bound to an oxygen. It does this through some kind of optical mechanism, and it's really helpful as an initial guide. But this thing becomes really, really unhelpful once the pulse oximetry reading on this drops below, I think about 92%. At that point, I think blood gases are a better way of looking at a person's acid base and oxygen saturations, overall oxygenation levels. So pretty handy little tool. In my case, I have a oxygen saturation of 97% with a pulse of 62 beats per minute, which is pretty cool. Next thing I have is this thing. This is called a little measuring tape. It's pretty cool because it's got the different colors on it, which can show you if a person is it's got different colors on it, and the colors, they change based on whether you're a girl or a guy. And this allows you to really measure people's waist circumferences, measure people's calf circumferences for things like calf swelling for a deep vein thrombosis, or even if they have anything that's got, or if they've got something like increased pressure in the fascia, which may require drainage, things like compartment syndrome and things like that. But mostly I use this for measuring people's waists and stuff. It's pretty cool. It's got this little round scale on it, which we use to calculate BMI, but BMI is not the best predictor of a person's overall health status. Usually you want body scans for that, and the overall fat percentage, because a person could have a BMI of 40, but a lot of that could just be from muscle. The next thing I have is this thing here. This is this, as you can read on it, it probably says Welch & Allen. This is my proper ophthalmoscope and otoscope kit. So this right here is the main body of it, and this is an attachment. This is the otoscope attachment, which goes on like so, okay? And you turn this around and it lights up, and you can actually attach different speculums on stuff on it. So here's a speculum attached to it, and you can see how it makes it a bit longer, so you can really reach in and look at things. But otherwise, pretty neat little device, pretty cool. And let's detach this, and I can show you the ophthalmoscope. This is the ophthalmoscope, and you turn it on like that, and you can use different things. And using this one, you can change the different lights and different split patterns and stuff. It's obviously, the battery is a bit low, so you guys probably can't see it that well. There you go, you can see it there maybe, but yeah, it's pretty good. These things are usually not needed. Most of the time, if you're in supervised clinical practice or if you're at a hospital, these things are often found at the patient's bedside. Sometimes they might even be found at other places, like they might be in the medical cabinet or something, and you just need to know how to get them. Usually the nurses know where they are, and if you ask them nicely, they will get them for you. The next thing that I have is this thing here. This, as you can probably read on it, says dissection kit, but in fact a lot of the components on this are part of my suturing kit, because that's another skill which is not quite so widely taught in medical school, at least in Australia. So usually we just find things to suture on. In my case, I use a piece of foam, which I could probably, in my case I use this little piece of foam here, which is a slight angle, and I just make little incisions on it and suture them together. I've already done a few sutures on them, as you can probably see. And yeah, let's show you what's inside this dissection kit. And that's what it looks like overall. The first thing I would show you obviously are my forceps. So this right here is a forceps. It's a forceps. It's a tooth big forceps. I like to call it a tooth big forceps. This is the tooth little forceps. This is the tooth medium forceps. And this is just a little pointy needle. I have no idea what this is used for, but it's in my kit, so I guess it's probably got some sort of use. Now moving on to this thing. This is my cutter. Funnily enough, this was not actually in my dissection kit. This actually comes from my computer fixing kit, and I found it to be more useful as a cutting tool for my little experiments that I do with my suturing. In fact, because it's got a nice low sharp blade, and it comes with this cap, which is it comes with this little cap which you can put your blade back into. Which you can put your blade back into like that without having to worry about anything and not injuring yourself every time you use it. Whilst we're on the topic of the sharp objects, I might as well show you this. This right here is a scalpel, and as you can see, it's got a covering on it because the blade on this is extremely sharp. So this has got a number 10 blade on it. So if you guys watch the Good Doctor, you often hear him say the word 10 blade please. So this is pretty much the scalpel he asks for, and this is what it looks like. This thing is really sharp. It's cut me many times. I don't use it much for anything at all. It's just in there because I've got it. And the blade obviously didn't come with the kit. I got the blade from my mother, who also happens to be a doctor. And yeah, that's the thing. Like, a lot of the stuff that I've actually taken you through right now are actually hand-me-down, so they're not necessarily things that you require as part of medical school. So if you feel like you don't have these things, please don't freak out. Most of these things are available at your placement. They will be available at medical school and at your clinical practice site, like a teaching hospital, quite widely available, in fact. Next, I've got this thing here. This looks like a little clampy thing, but this is actually a needle holder. This is a needle holder. It's used for holding needles. So I've got a needle here, which I can probably hold for you. There you go. And this is what it looks like. There you go. That's the needle holder holding a nice little cutting needle, as you can see, which is pretty cool. Yep, so this is a needle holder. This right here is an artery clamp, very similar to a needle holder, except that the grooves inside it are parallel instead of angled like they are in the needle holder. So this thing, even though it can technically hold needles, is not actually very good. Every time I tried to suture with this thing, the needle would slip out or the needle would turn whilst it's inside the grip of it, which is not ideal, especially if you're suturing on real people, which this has never been used for. I usually use the sterile kits available at the hospital for that. But yeah, if you're suturing on a real person and the needle is going all over the place, it's going to be a very painful experience for them, even with the lidocaine. So be careful about that. This is surgical scissors, some snippy snippies, and this weird pointy tool thing. I don't know what this is for, to be honest, but it's a nice little pointy tool thing, and it's in my surgical kit, but I never use it. So that is my dissection kit. Next, I'm going to show you these things. These things are called neuro tips. They're very cool. I have a whole bag of them, and I went through them like anything on my neurology placements. They're called neuro tips because they're actually sharp, as you can see. Focus. Yep, so that's not going to find focus, just believe me. I'll probably put a picture of it on the thingo. There you go, that's focused. So it's got this sharp tip here, and it's got a blunt tip on this side. So we can use this to actually test for neurological function. For example, I could poke it on different dermatomes on your hands. For example, this is C6, C7, C8, T1, etc. And we can use that to find out whether or not you have normal sensory function in the anterolateral ascending columns, and that's just medical terminology that says that you can feel pain, which is good usually, because some people can't feel pain and they end up causing themselves a lot of harm that they're not aware of. So that's my neuro tips. I have a few of them. Obviously this one is already used, so it's going to go into the sharps bin. The others are still brand new, and they will probably be in my bag for the foreseeable future. The next thing that I have is this thing. You probably recognize it. This is a hand-me-down from mum as well. This is called a sphygmomanometer, which is basically a blood pressure cuff. So here it is. It's an electronic blood pressure cuff, which means it's absolutely useless for medical school, because in medical school, all of your blood pressure assessments are going to be done on the manual ones, the ones with the squishy pump thingo, and you'll have to actually listen for the Korokov sounds in order to find the systolic and diastolic blood pressures. But I think the vast majority of these cuffs available in the hospitals are electronic anyway, so idea to know how to use these. I think it's better idea to know how to use the analog versions of these, which are with the squishy things, so that you actually can take a blood pressure even when your blood pressure cuff goes flat, which happens very often because it's a battery operated device, and battery operated devices never never work when you need them to. So it's always analog is always the best option. Other than that, I think that's pretty much it. I think I've told you everything that I needed to tell you regarding the stuff that I own in terms of medical equipment. Obviously, I have other things like dressing kits, alcohol swabs, and some suture material and stuff like that, but those things are irrelevant and consumable, and you can probably get them online somewhere that I go through. But the thing that I use the most out of this entire thing is obviously the stethoscope, maybe this light thingy, this thing, the tendon hammer, and maybe this little measuring tape thingo. So these are the things which are always in my bag with me when I go on medical placement, which is great. Anyway, if you liked the video, leave a like, leave a comment if you want to find out more about the stuff that I own. This is obviously not the extent of it, but these are the things that I use commonly. Yeah, so just let me know what else you guys would like to see from me. I'm still trying to find out what this channel is going to be about. So yeah, awesome. Subscribe, and I'll see you in the next video. Bye bye.